You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We're talking about dental implants today with Dr. Hall. Dr. Hall, welcome to the program.
Very good to be here, Randy.
Now, we've had your partner
Yes.
on the show,
Yes.
Dr. Eli Jackson.
Yes.
And you've worked together with him for quite some time.
That's right.
Now, for people that don't know you and your practice, who's the typical dental implant patient that you see?
Randy, the typical dental implant patient can be people who are currently wearing dentures now that are not secured to anything.
Okay.
They can also be someone that is heading to a denture. So maybe someone with failing teeth. Teeth are going bad. They're not able to chew and they're not able to eat. They don't like the way they look. And this person's going to a denture and they're looking for a solution, and that's what we have. You know, Randy, another group of people are the patients who come in. Maybe they've been told elsewhere from another office they need dentures, but you know what? They don't want dentures. They don't want to deal with dentures. Maybe their parents had dentures and they saw the fits that they had wearing a denture. So they come to us and we can offer them a solution for implants to fix that denture into their mouth.
Now, you're a dentist, okay? And of course, you think the smile is important. How important is it?
Oh, Randy, the smile is so important. It's so important. The first thing you can notice about someone many times is their smile. You know, all of these surveys are done and what is most attractive about people, and smile's always in the top 3.
That's right, that's right.
And it conveys so much communication to people you meet. You can go somewhere that doesn't even speak the same language. You meet someone who is smiling back at you. What do you immediately think? This is a friendly person. You go into a party, you see someone across the room and they are smiling ear to ear. You may not know that person, but you see them from a distance. They have charisma, they have confidence, they are happy. I want to go meet that person. You get, maybe you're going in for a job interview. You know, you've got 2 sisters, same resume, they do the same things, but one goes in smiling, one is confident about herself, smiling in this interview, one is not. Chances are the person who is smiling in that interview is going to walk away with the job.
What do people like most, especially the denture wearers, okay? So I guess the whole idea is that dentures, like traditional dentures, are out, right?
Right.
And that everybody should have them either snapped in, like a full arch of teeth snapped in, or something that is in there permanently.
Exactly.
Okay? Are there a lot of people wearing dentures where you are?
Oh, Randy, there's so many people wearing tens of thousands of people wearing dentures around us. I mean, there's no doubt about it. So there are a lot of people.
Why aren't they all doing it, though?
Well, you know, one thing, Randy.
I asked Dr. Jackson the same question.
Yeah.
What's your take on it?
My take, there's a lot of people who are wearing dentures, and their dental lifetime was full of pain, was full of treatments that they did not enjoy, pain, inability to chew and eat. You know, they've been through root canals and crowns and fillings after fillings and gum treatments. You know, they've been through bad breath and having to deal with this. It's a lot of money. You know, they look at it as a money pit. They've spent so much money in their mouth and it's not getting them anywhere. So these patients come in, they've had bad experiences. They have not had good experiences in the dental office. And so they finally reach to the point where they feel like they need to get their teeth taken out. And they're almost relieved. You know, they get there and, because they've been through so much pain, so much suffering, and they are just ready to be done with it. And so they come in, they're just relieved to be getting dentures and to get the teeth taken out. And then what happens is they disappear. They no longer go to a dentist. And so without them being in the dental office, a lot of times they just don't know new treatment options. And dental implants,
don't know you can do this.
They don't know that it's possible. And that we can take a denture that they are used to wearing, and it probably gives them fits, and they're tired of wearing, but we can actually attach that to something.
So your partner, Dr. Jackson, said, he goes, I want you to interview Dr. Hall. He's been with me quite some time now, and he's like this young dynamo, learning all the new stuff. Is this the newest trend in dentistry?
Without a doubt.
Like, you'll see it, do you think, that where there will be no more like regular dentures that just go on adhesive?
Oh, I think it is very easy to imagine in the future regular dentures not attached to anything will be a thing of the past. You know, we just have, implants provide such a better solution for these patients. They're not having to worry about them falling out, you know.
Do they worry about that?
Well, let's look at the life of a denture wear.
Okay.
You know. So they have to plan ahead for everything, you know. With teeth, and you're wanting to go out to eat with your friends, you can look at a menu and whatever mood you were in that night, you can order steak, or you can order the chicken, or you can order the fish or the pasta. Denture wearers have to look at that menu a totally different way. They have to look at it, what can I physically chew in front of my friends without embarrassing myself? The roof of the mouth is covered. A lot of times that's taken away taste. Food just doesn't taste as good. You know, they are missing out on taste and flavor and what they would truly feel like eating that night. You know, they may go out and they may be active. They may play golf. They may play tennis. They may, play on the church softball team. And
so it's hard to have like a running around sport when you have a denture.
It is without a doubt in the back of their mind, because in the back of their mind, they're thinking, what am I going to do? Or can I potentially do something that is going to make this denture come out, fall out in front of these, you know, all these people, these friends, and then it's embarrassing for them. So the life of a denture wear is unpleasant.
Because I never hear them complain. I know a couple. I told this to Dr. Jackson. I said, I never hear them complain.
Well, they're not going to complain to you, Randy. So they're gonna want to act like everything is great with them, you know. But they will come to us and they will, you know, they're getting sore spots, or they, you know, their bone has shrunk a little bit from where they don't have teeth, and the dentures aren't fitting as well as they used to, and they need to, and they lose their confidence to eat, to speak, to chew, to sing, as if they had their own teeth. You know, they don't feel like they can do it anymore.
With these snap-in dentures, okay? What can they eat?
Oh, we have patients coming in and they're eating the same foods that they were eating before. They're eating healthy foods that are crunchy, you know, foods they have to chew a lot, foods that they couldn't really do without dentures that are attached to implants. So they're able to eat a more healthy diet, more nutritious diet, and they're able to eat foods that they enjoy, that they liked growing up, and they can't eat anymore. Now,
insurance, and I brought this up with Dr. Jackson, that insurance does not really cover the cost of dental implants here in the U.S. I mean, maybe the maximum payout is like $1,000 or $1,500 or something like that. But you guys are into financing, and you told me about the payments in the green room. I mean, these are relatively low payments.
These are
to get teeth.
Yes. We can make it easy for people.
Is this common?
To
you finance
afford
it?
This? Very common. Oh, every day we're having patients coming in and they are financing treatment to be done, just to make it more affordable for them.
How old can you be to get this done? I mean, what's the oldest patient that you have seen?
Randy, I think we've seen, you know, patients up to their 90s.
So 90 years old, cosmetic? They're worried about cosmetics?
Oh, yes, they are. They want to look good just like you do, and they want to be able to smile and let their personality show through, just like if they were 50, 60.
But I mean, statistically, there must be scientific or data with dental implants. If you're 90 years old, are they more likely to fall out than if you're 50 or 40?
No, they're not. You know, as long as we have the ability to place an implant in there, then statistically, they are not going to fall out as, you know, at any greater rate as if they were in their 30s or 40s.
So you brought some photos of how you say it changes their appearance and their self-esteem.
We did. So this is a woman. She came in to see Dr. Jackson, and she just realized her teeth were not working for her anymore. She's a singer. She loves traveling around singing, and it was not, the current state of her teeth was not helping out. And she came in, and you'll just be blown away, Randy, at the results. She came in, and she left with that smile right there, attached to implants that she can confidently sing with, and chew with, and smile with, and really be confident about herself. And look, it just, the result is great. It just takes years off of her. Yeah, so look at these photos. Look at the before and after, the difference that she has. She looks healthier, she looks younger. She looks like she has more energy, more charisma,
it is more attractive.
Confidence.
It's a more attractive look.
It is.
I gave you both a hard time in the green room saying, you know, it's just teeth or whatever. And then, you know, when you look at pictures like this, it's more than just teeth. Yeah,
it is. This is a change in person. a change in personality that is able to show through now because of her new smile.
So this is a cosmetic, I mean, is this like cosmetic dentistry in a way too?
It really is. Doing this kind of treatment is cosmetic dentistry. I mean, we are taking someone who has had, maybe bad teeth for a long time or just a denture that has been giving them fits, and we put something new in there that looks great, that fits that person, fits their face, is feminine if they're a female, is masculine if they're a male, and they, it transforms who they are.
So take me through the process. I mean, a patient goes in on day one, let's say it's a denture wear, right?
Okay, yes.
What happens on that consult with you?
Well, we just talk about their options and what we can do for them. A new denture, a new set of teeth that will be attached to implants that they can take in and out, or a set of teeth that stays in their mouth that they cannot take in and out. They have different options that they can go with. So another way we can show them what the result will look like is we can show them pictures of past patients who have needed the same treatment. Also, they'll come in and they'll be able to see what their new teeth look like before they are done being made. So they
get like
actually
a trial
put them
smile
in their
kind of?
mouth. Yes.
All right.
Put them in the mouth, smile with them, make sure they like the way it looks, make sure they like the bite, make sure they like support of their lips. Ladies come in frequently and they want more lip support. They want fuller lips, and that's what this treatment can do.
How does it give you fuller lips?
By giving, teeth support our face. And once the teeth are gone, then our lower half of the face loses a lot of the support that it
gets like
that
sunk in.
It becomes sunk in, and a new set of teeth can fill those lips back out, make them really look younger, look good.
Yeah, but isn't it true though? Okay, well, let me ask you about the denture wear one more time. If you've been wearing dentures like 20 years, 15 years, you don't have enough bone to do this.
Maybe. You may not. Everybody, of course, is a little bit different. But if you have previously been told that you don't have enough bone for implants, which you may have heard that in years past. You as a patient coming in, you may have heard that you don't have enough bone for implants.
You hear that from patients?
Oh, we hear it all the time.
Okay.
They come in all the time. But that may have been true 5 years ago when they heard that. Recently, we have new treatments now. We can build bone. We can basically make bone where there is no bone to be able to put implants into and give them a good fixed set of teeth at that point.
Is there a tipping point, in a denture wearer's life, that they finally have had enough and then they come see you?
There is. A lot of denture patients will come in and they'll say, I sit around at home and the denture's not comfortable in my mouth, so it's sitting over in a cup somewhere. I'm sitting there watching TV. Surprise comes from
So when nobody's around, they don't wear the denture?
When nobody's around, they don't have the denture in. I had a patient just the other day, he came in, he is looking for some implants to keep his denture in his mouth, and he said, I'm tired of chewing my food and my denture at the same time, because he couldn't keep it in his mouth. So he's trying to eat and the denture is just flopping around because it's not attached to anything. And so finally, enough was enough. He gave us a call. He wants to come in and get his teeth attached to some implants.
What about the people that have really bad gums, right? They have gum disease. Can they do this? I mean, will the implants stay in their mouth?
Yes.
Or they can't do it?
Yes, they can do that. And this is a frequent treatment for these people. This is something we do all the time. People that have had gum disease and they've lost teeth over the years. They have, bad bleeding gums, and it makes it to the point where they can't chew. Their teeth are loose. They're flaring out. They don't like the way they look, and really they're not able to eat nearly the way they want to. And so they come in and they're looking for the same thing. And so with these people, they have teeth in their mouth, and so what do? We come in, we get them a new set of teeth.
If you can't save them, you can extract them.
If you can't save them, we can take the teeth out, and they can leave that day with some new teeth. Okay. Same day the teeth come out of their mouth, new teeth go in. Well, let me just show you another example of some work that's been done in our office. Take this lady, for instance. She had teeth that were broken. She had a bunch of bad fillings in her mouth, things that was just in disrepair. And she did not want a loose, ill-fitting denture. And so she comes in, Dr. Jackson sees her, and she leaves with a set of teeth that are kept in her mouth with a set of implants. Look at her, she is happy. It takes years off of her.
That's true.
She looking great, looking
look
happy,
real.
looking confident, and they look great.
How much are you involved, I guess, with the lab to make them look like this?
Oh, very involved. We don't want to put a final set of teeth in that patient until they're going to like the way they look. Okay. So that patient, when they come in, they're able to look at exactly what these teeth are going to look like once they're in their mouth, when we can make any changes at that point. And so we can tell the lab, change this, adjust that, different color of teeth, different kind of teeth, and really get it to where the patient likes the way they look and they know what they're going to get before the final.
Okay, good. So nobody should be wearing dentures.
So nobody should be wearing.
This is your feeling.
Yes.
Period. Nobody should be wearing traditional dentures.
Exactly. Exactly.
All right. Now you brought some other photos.
I do. Here's a patient of mine that came in. She just did not like that gap in her front teeth. And she was looking for something. She had other issues going on. She's in healthcare, and she was wanting a good, healthy-looking smile. So with her, we ended up getting her a new set of teeth. She came in. She leaves with her new set of teeth, and she is smiling ear to ear and just happy as could be. So here's another patient, and this is just an example of how a new smile can change a person. So he came in. His daughter came in.
Now that looks pretty bad. That's got to be unusual.
That is not unusual at all. So there's people like that walking around with teeth looking like that. They're just not smiling. They are holding their smile back. And that was the incredible thing about his case. He was fun to work with because at the end of it, once we gave him some new teeth to smile with, his family said he'd never smiled as much in his life. And he is just happy as could be, loves his new smile. So with him, we, replace those missing teeth with a really cosmetic bridge that lets him smile. And it's an affordable treatment for him that has transformed, his ability. His kids come in and they tell us how happy he is.
So in your practice, back to the denture wearers for a moment, or the people that are just about to get dentures, that means they have to have extractions. What are their options? What's that discussion like as far as dental implant options?
We give them options. They can start with 2 implants here on the bottom, and they can get a whole set of teeth that snap in and out with that.
What could they eat with
stays
those?
in their mouth a whole lot better than a lower denture without any implants at all. So opens up a whole lot of foods, so they can start biting into things better. They like hamburgers, pizza. Opens up some foods that they would have really not been able to eat before. The next level up, they can have 4 implants and a new set of teeth that snaps into those implants, and they can wear it without adhesive, and they can chew just about anything they want to chew.
What do they eat where you are? Like, what do you hear? What do they like eating?
We hear steak, chicken, pizza, you name it. They're going after it. Ribs. So they're able to really chew a lot of foods with these teeth with 4 implants. The next option up, you can always do 6 implants, and with that, that's just as much. That's about like having your own set of teeth in there. The next level up would be teeth that don't even come in and out. I mean, they stay in there. They are attached to the implants. The patient cannot get them out. And it's basically a bridge of teeth, a full set of teeth that does not come in and out.
It seems like that's what people would want, teeth that don't come in and out.
Certainly. That is what feels more like what they had before they lost teeth. They even come to they would even come in to see us for cleaning appointments every 6 months.
Every 6 months.
Really just to keep the implants healthy and keep the teeth healthy and looking good.
What about the upper? What do you do for because isn't the upper fine as far as the denture because of the suction?
The upper, people generally do a lot better wearing an upper denture than a lower, but the problem is the roof of the mouth is covered. And so patients come in all the time complaining that they can't taste foods like they used to. I had a patient one time, I was looking at her, and she had a denture, she had an upper denture, and I looked in there, she had these sore spots. And I said, what caused these sore spots? It didn't look like a sore spot caused by a denture. And she said, well, I wanted to eat some potato chips. And when I have the denture in my mouth, I can't taste the food as well. So I took the denture out to eat the potato chips. And I thought there's got to be a better solution than a patient taking their denture out just so they can taste potato chips better, because I mean it's just cutting up her gums and really
I guess,
making things
like
painful.
the salt and things like that. I mean, you can't taste that.
Yeah, you get sharp edges, it goes right in. But
oh wow,
the great thing about doing implants for the upper set of teeth is with 4 implants on the top, you can have the roof of the mouth cut out of the denture, and so the roof of the mouth isn't covered. The patient can fill the roof of their mouth with their tongue. When they're eating, they can taste better, so much better, like their taste was before they had their denture, and really gets them feeling like they have a good set of teeth again.
So pain is not, because pain, you say is like the number one reason why these people don't want to come in. But you say pain is not like a big thing that they're complaining about. They're sedated while it's being done.
Right, yes.
Okay.
We do sedation, we offer sedation, so relaxation of these patients for this treatment. We have so many patients that travel to come see us because we do sedation. They know that we're gonna be able to do their treatment without them being scared.
You love it. You love it. Actually.
Oh, I love it. It's incredible just how many patients will come to see us because we do offer sedation for treatment. And they'll come in, we'll sedate them, they will get their treatment done, they will be comfortable, they will leave, they'll get home.
Is it like they don't have a memory of it? Is that true?
And
that's what Dr.
the vast majority of the time, they will have no memory of treatment at all. They get home, of course they're drowsy when they leave, they'll wake up and they'll wake up and they've got a new set of teeth in their mouth and they don't remember how they got there. So sedation is great. Another great thing about sedation, we have patients that come to us, they've neglected their mouth for 20, 30 years. I mean, they just haven't been able to been in to see a dentist in 20 or 30 years because they were just scared. They had a bad experience when they were young, and they do not want to live through that again. Well, they hear we do sedation, so they come and see us. They may be so scared that they're crying as we are just looking in their mouth.
You've had people that do that?
Tears. And we're just looking around with a mirror. I mean, they are just reliving those bad memories from before. So we come up with a plan for them, for their treatment, what they need. They come in for sedation. We do their treatment under sedation. Everything goes well, and they leave having a good experience, and they don't remember being there. But what happens to a lot of these patients is in the future, we start seeing them regularly. And there's a transformation with them. They're automatically more comfortable being in the office. They don't mind coming in. They get over their fear. And so if they need work in the future, a lot of times they don't even need sedation. So they come in and they're just much more relaxed, much more comfortable, and we give them a good experience, and they use that to grow, and they really are in a much better dental health after that because they're able to come in for regular visits.
We are just about out of time. But what do you say to the patient, right? They're in their denture. Maybe they've been wearing them 10 years, and they're afraid to go through this, right? Or the person that their teeth are falling out, right? They're just bad. What do you say to them? But they're still skeptical, or they're worried about pain, or they're worried about cost, or whatever. What do you say to them? Final message.
They do come in skeptical. And they're wondering what kind of a result we're going to be able to get to them. But, take for instance, I had a patient, he came in, had bad teeth for a long time, and he was needing to get those taken out. And after treatment, after we got him a new set of teeth, he came in, said, I wish I would have done this years ago. This was the best thing I have done in a long time, because we have taken something that was just miserable for him, his teeth, the current state of his teeth, pain, not able to chew, not able to smile with confidence, and we were able to give him a new set of teeth that made him happy, that made him more confident, that made him more, better to smile more and to chew better. Patients like this are out there. So they may come in skeptical, but once the treatment is done, they see what the benefit
like they should have done it
like they should have done it long ago. They shouldn't have let fear get in the way. They shouldn't have let the cost or being scared of coming in to see us, or that they would be judged by coming in because of how their mouth looks and the state their mouth is in, they should have come in sooner.
So people, it's common then, I guess, 40s and 50s to be wearing a denture.
Yes.
So that's too young. That's way too young.
Well, any age is too young to have to be dealing with a denture that's loose, that doesn't fit well, that's flopping around their mouth, that's not kept in with some implants. And that's why it's just so important for people to know that this option is there, that they can do this, that they can get some implants in that keep the dentures in their mouth. If you're young, some implants there that keep bone where it is, so you're not losing your facial support, and so you get to look younger.
Now there's one photo right there, and I know it's Dr.
Yes.
Jackson's, but you did it at your center. So this is a woman, I guess.
Yes, that she's not wanting to smile. I mean, she is not wanting to show her teeth. Her teeth are not working for her. And she comes in, has her treatment done, and she leaves with a great looking smile. Teeth that are going to stay in her mouth because of the implants, and she's going to be able to speak and chew and smile confidently, and she's going to let her personality shine through.
Good, good. Now we're out of time. Now I know you flew in here for this interview.
Yes.
Is there something you wanted to say? I mean, some main message you wanted patients to know about what you're doing that you could say right now?
We just want patients to know that they have a great treatment available to them that will give them a better ability to chew, smile, speak, sing. They can feel younger again because they can feel more like their natural teeth. If you are having fits with dentures, or if you are heading to a denture, there is hope, because there are treatments that we can offer you, and there are things that we can do that give you a sense of a better smile, a better set of teeth, no more pain, no more being self-conscious when you're out to eat with friends. You can get some implants, you can get a new set of teeth that snaps into some implants, or that is fixed to these implants that you can't even take in and out, that give you a great smile again, that looks great, that feels great, that makes you feel better about yourself, and that gets your confidence back.
And I know you don't. I know Medicare and Medicaid does not cover this, but you have financing, so low payments, you could get a full arch of teeth, upper and lower.
Exactly.
That no longer that don't even come out.
That don't even come out. That's right.
Good. I want to thank you for coming on the show.
Thank you very much.
And very interesting. If they want to learn more, they just go to the website or call you. And it's a free consultation.
It's a free consultation. We can get you in, and we can go over options for you and for ways to really help you out.
Okay, great. I want to thank you.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news, with your host, Randy Alvarez, the authority on health issues.